BCS families depend on safe bus transportation each day for their children. Now, more than ever, this means special consideration is given to various health and safety practices to ensure both drivers and students can travel safely to and from school. BCS staff will work to keep the floors free of debris and common surfaces both cleaned and disinfected more frequently. These surfaces include front and rear entryways, windows, handrails, walls, and all sides of the seats. For drivers, this includes steering wheels, seats, seat belts, and controls. Drivers, students, and bus health and safety support assistants must be screened for symptoms and a fever prior to entering the bus. Parents should wait with their child at the bus stop until the child is screened and cleared to ride the bus. Students will sit one child per seat, or up to 3 children per seat if they are siblings, and all students must wear a face covering. Frequent sanitization and safety practices help reduce the spread of COVID-19 and provide a safe and dependable ride to school.